We are getting ready to go ahead and bond on our permanent veneers for Miss Jodie here from the United Arab Emirates. I got to say it right. I didn't realize I say it wrong. I used to say Emirates. I don't know why.
Oh, okay.
Yeah, isn't that
You're
weird?
good.
Yeah, he corrected me on that. Make sure I get that right. So we're excited to go ahead and finish off your smile. She's been an awesome patient for us today. So we're going to go ahead and get that done. But here's the interview we did prior to starting our treatment this morning. And enjoy that for about 3 minutes, and you'll come back to seeing us bonding on the veneers. Here with Jodie. This is going to be an exciting day. You all may remember her from the Summer Smile giveaway. She was our awesome winner from Dubai. So welcome to Missouri, Springfield, Missouri.
Yeah.
Now, I didn't even ask you. Have you ever been to the United States? Where have you been to?
Yeah. So I mean, we live in Dubai. I'm not from there per se, from the UK. But we did come last December to Florida.
Okay.
And then we also went to Chicago. We did like a little trip around, but we went all throughout Florida. JJ's family are from there, so that's why we kind of did a little
JJ
trip.
is this awesome dude back here that actually nominated you, right?
Yeah.
So, hi, JJ.
Yeah, he didn't actually show me his nomination video. He said, only if you win, I will show you
There
it.
you go.
So.
There you go. Awesome. So, tell people what they asked you when you were trying to come into the U.S. yesterday.
Yeah, so I mean, the US are quite strict. So when you come in, they're asking you questions, why you're here. You know, they really want to make sure you're here for the right reasons. And we told them we're here to go to the dentist. And the guy was like, "Well, he better be a good dentist for you to come all this way." But yeah, we promise.
Boom.
Think, yeah, because he didn't. I think he didn't even believe us. It was so funny.
Right.
Like, really, we're telling the truth.
That's cool.
Let us in.
Well, anyway, so kind of what to expect today for those who are maybe watching this, and we're not going to. So we're recording this right now. We're going to do the work, and then we'll all mirror it together. So that way, your experience as far as the viewer is just going to be able to watch this interview, and then we're going to go right into kind of finishing up your treatment. So rather than have it span out over a length of time, and so what to expect is we're going to transform her smile a little bit here. She's got a tooth that's a little shorter. We're going to make them wider, and then kind of share with them why you're wanting the smile to be transformed. I know there's kind of maybe a big event coming up.
Yeah. Well, one of the things that we find quite funny is we had the conversation, and JJ basically said to me, you know, if I asked you to marry me, what would you say? And I was like, no, not until I get my teeth done.
so JJ's was on the hunt.
And he was like, okay.
Yeah.
So that was one of the main reasons, obviously, is that when you have that day that the picture's going to be everywhere, you want like that smile to be right.
Yeah.
So that's one of the main reasons.
Great. So today we're going to put together. I mean, this is a great story. You've got a smile, a bright smile. You've got love. You've got a wedding at the end. Obviously, we won't have the wedding at the end today. That'd be kind of cool, right? But maybe we can get some photos down the road. And bookend it for you. Yeah, we had surprise.
Yeah.
So here we go. We're going to go ahead and start the transformation, and you'll be cut right back in when we are finishing up and adding the veneers to our teeth. We're all going to do this in a single visit today by manufacturing and making all the veneers here by yours truly, and some of the coolest technology that we're able to use to help our patients not have to have the hassle of lengthy visits, multiple visits, and obviously being able to help somebody from anywhere on the globe in a single trip is huge for us. So by the way, a little selfish plug there. You can go to yoursmiledestination.com if you want to go ahead and submit and see how we can help you smile even bigger and brighter and happier. So do that if you want to have us give some information for you. So here we go. Let's do it. Well, welcome back. Hopefully you enjoyed that interview with Jodie. She's a pretty cool gal that made a long trip to get here to have this smile done. We are just getting ready to bond the permanent veneers on. We designed them in our computer software after imaging them digitally. Just making sure she's fully comfortable. For a little bit of air we have to kind of put on the teeth to prep them for bonding. We went ahead and already prepared the veneers, and they've all been polished, and each one's customized. I think a common question we get is, can you floss in between each one of these? And yeah, they're all separate, so absolutely. I already did that, so go ahead and get that. So first thing we do is we put a desensitizer on the teeth to try to help with sensitivity down the road for Jodie. And then we go ahead and start applying the bond. to the teeth. Hopefully the whole 2 or 3 of you who are watching this are having a great day. Literally singles of you watching, dozens. So before, Jodie had just kind of teeth that were smaller and a little bit worn and a little bit pointed on a few of those front teeth, and then obviously not perfectly straight. Down the road, we talked about maybe doing some options to help with the Invisalign. Obviously, being from, working from Dubai, it's going to be difficult for her to do Invisalign here in the States, so I encourage her to go to a doctor there. All right. Go ahead and cure that. Probably picking up all my trying to hum Christmas music that's in my head. I just realized I'm humming. Mike's like right there.
I'll take that. Great voice.
Dr. Jordan's wanting to make a little visit into the video, but she loves the camera. It's been like 5 months since we can't,
You're getting to every question of where are your loops from?
loops. I think these are designed for vision. Brand loops.
Company,
Yeah, designed for vision.
What material did you use for the veneers?
So we use Emax, which is incredibly hard, beautiful porcelain. One of my favorites. Another great one is Sultra Duo, though both are nice and strong and look really pretty. They don't, I guess you possibly could fracture them. I've just never seen it really. They take it so much force to do that unless it was an accident, I don't believe you'd witness a veneer fracturing with Emax. What I'm doing here is just basically cleaning up enough to make certain that all of the veneers are perfectly set, because nothing's holding them on there right now other than just a little bit of hydrostatic, just a little bit of the resin kind of sticking it there. Go ahead and give me some floss there now. I'm just kind of reseating and making sure everything's positioned correctly. lot of flossing here. Doing awesome, man. We'll use a little bit of the separator there to get through 6 and 5 and 6. Here, go ahead and clean up. Go ahead and clean up number 5 here. We'll rebond that. Came off in our bonding. Okay. Thanks. So in that scenario there, we had one of the veneers come off while we're bonding, so we don't continue with it. We'll clean it up and then bond it again by itself. That way we don't worry about it not being correct and staying there, because everything's already started setting up. Doing great. We're just kind of cleaning up around your gums, and I'll floss again. All right, open there for me. Good. What you looking for there, Amanda? All right. Probably need some music over this, don't we, Michael? Don't listen to me humming. Nice job. Oh, you're going to love these.
What's the beautiful.
So Amanda's just helped me, I think, on a couple live treatments, and she's making a go of it at dropping something on the floor and losing it at each one. So it's kind of like her thing.
I have good things too.
You have amazing good things.
Nobody knew about the first one, okay?
That's true.
Until now.
Until now.
Thank you for that.
Why is veneers and not build up with composite?
Why what?
Why do veneers for shape instead of building up with composite?
So composite is always a temporary solution as far as longevity and stain resistance. And then they also wear and chip considerably different than a porcelain veneer would. Also, I mean, the lifelike nature of porcelain versus the lifelike nature of composite is just different. So I think all of those reasons are why I would prefer porcelain for a long-term solution to correcting shade and shape. Almost got it all done, Jodie. You're doing awesome. Okay. Let me try on that one that came off here and make sure we can get it back on. Go ahead and turn to your left there for me. Thank you. Thank you. Great. Okay. So what other questions do you guys have that are, how many people, like 3 people watching maybe? What do you guys have? What did you say? So 32 of you guys watching, what questions do you have about same day veneers, porcelain veneers? And you'll get to see her smile here in just a few minutes. I know that's probably what a lot of people are even sticking around for, is to see that. So we'll set her up and you guys can see close up. Obviously she'll be numb, so won't be able to smile fully naturally yet, but that'll wear off over the next few hours, and then she'll be able to enjoy her smile. And you heading back to Dubai tomorrow, is it? Now staying in town a little bit? You're in texture there. So you'll notice with the other teeth, when I was doing all 10 at the same time, I don't do a tack cure, which is what Amanda's doing now. Go ahead and tack cure the buckle. But a tack cure starts to set up the resin just a little bit, and so you don't really have a whole lot of time if you use that to clean up. And so I only use it if I'm doing maybe 1 or 2 teeth. That way I don't have to worry about cleanup being a problem. Because once this bond and resin sets up, it's incredibly hard to get off. Trade you.
How does insurance work with
Do you have
veneers?
So insurance is not really typically concerned if you have a nice smile or not, or even honestly a balanced bite or any of that. So they don't cover a lot of things that maybe you might want, but they typically don't cover cosmetic veneers. They consider that an elective treatment, which in most cases it is. Sometimes, like I've spoken in some other videos, it can be used for restoring teeth with decay that don't have cavities on the backside, and in that situation, we may call it a 3/4 crown or some sort of different restoration or a partial crown that insurance typically is more likely to help cover for our patients. So what I'm doing here is just polishing up the little bit of resin on the backside, so it'll be nice and smooth to her tongue. Then we'll verify the bite is okay to work with, and she'll not have her bite changed, anything hitting too soon. And you'll be able to tell all of these are individually designed and just should look very much like her natural teeth. What's up? Okay. Oh, okay, cool. Where's he from? Where's Adam from? I think it might be the gentleman I spoke to from Alabama. All right, I'm gonna check your bite here. Go ahead and bite together there. Tap, tap, tap. Kind of chew down and bite together and open. And do the same thing. And open.
Yes, Birmingham.
Yeah, there we go. Yeah, tell him I said hello. I talked to him maybe a month or so ago. Go ahead and bite together again.
How long do veneers typically last?
And open. So veneers have that's a question that gets asked I think almost every time we've done one of these, but that's a good one. Go ahead and bite together and open. So veneers, just like, I kind of equate it, I think it's pretty easy to talk about it in a way that we're used to this transaction, most of us, and that's a car. So how long does a car last? Well, that's a component of a lot of factors, right? I mean, it's how well designed was the car to begin with, what materials, how was it engineered. So the smile the same way. I mean, using materials that is almost never going to fracture is going to be super helpful. Prepping the teeth in a way that helps avoid decay, which is how I prep the teeth there. That's really helpful because that's obviously another kind of threat to a veneer would be decay or maybe a fracture. And then obviously maintenance. So just like a vehicle, if you buy a nice vehicle, you can buy the best one on the market, but if you don't ever change the oil, that engine is going to clunk out on you. So it's important to see your dentist regularly, get your checkups, make sure that you keep plaque and tartar off the teeth to help keep the gums and teeth healthy. All of that can give you many, many decades. So I know I can't give you an exact answer because there isn't one, but I've had some patients that have had veneers that have been done even with not as nice a material that have been in their mouths for 20, 30 years. So you can imagine we should be able to get that and more with the better materials and technology we have today. So I wish I could make that answer much shorter, but I don't think there is a way to do that. So there are a bunch of great bonding agents out there, but the ones that we currently use is going to be Vario Link Aesthetic is the resin, and then Adhese Universal is our bonding agent. And then I use a total etch approach where I 15 seconds, 30 seconds total on the enamel and 15 on the dentin. Let's go ahead and polish here. Yeah, you're going to love them, girl. We're just getting to where you can feel pretty smooth with your tongue. All right, go ahead and feel the back side of those with your tongue and let me know, is there any area that feels rough? Can you see him a little bit there, man? Yeah? JJ's trying to take a little peeks from the side, so what do you think?
I don't think so.
Okay.
I mean, my tongue's a bit dirty right now.
Yeah, feeling a little dead. Okay. Let me go back and just make certain. We want smooth. Especially since you're going to be catching a plane.
Mm-hmm.
Not if you don't change the bite, so that's important, right? So I don't know if you were able to show them the time-lapse video of designing all of these, but I designed all these in software with her bite in mind. So we did not change her bite. So when she bites together, go ahead and bite together for me. We still connect on all of our back teeth like we should. Down the road, like I said, we've talked about really addressing maybe a little bit of alignment with some Invisalign, but cosmetically here, we were able to give her a full smile in a single visit without the months that it might take for Invisalign. Obviously a challenge for us with the travel. And since shade was a concern too, and length, all of these factors make veneers a great option for us here. And it doesn't prevent her from doing Invisalign, so should she choose to do that down the road, no big deal.
What micron thickness do you tell us there to leave for the silhouette?
Oh, wow, that's a pretty detailed question. I go for 130. The software, I believe, always puts 120. That's their set. So I'm at 130. All right, Michael, I think we're about ready for you to get a good close-up here and then reveal it to her. I'll set you up in a way that you can see it and he can see it, and then I'll hand you a mirror so you can see it. And you said no light, right? Do you want me to get the shades at all? Okay.
The anticipation telling you.
Yeah. Ooh.
I don't like the
You don't like surprises?
Unless it's big presents.
Big presents?
Well, this is kind of like
Consider this a big present.
This is a big present.
All right, you can got them in the camera, you can see it there? Okay, let you see them. You can hold this if you want. You can probably look around better than I.
Whoa. Whoa. Those are really nice.
Cool,
Yeah.
good deal. We can take this out a little bit and you might be able to see a little.
I got you.
Do you want me to help you with your lips?
She's pretty numb because we obviously have to have the teeth numb while we bond, so. Yeah, you can kind of see a little bit there. A little bit better look.
That's so nice.
Nice shade, you like that?
Yeah.
Yeah. Very cool. Awesome. Well, thanks, Jodie, and thanks, Amanda, for your help today.
Oh, you're welcome.
Michael, thank you. So I hope everybody learned a little something from this same-day treatment. I know it wasn't the full start to finish, but it was a blast giving you a smile, and I wish you guys the best. You guys are pretty cool people. I think Love's in the Air might be a wedding coming soon. I don't know, hopefully.
You better send us a video.
I definitely want some sort of photo or video from that for sure. So, cool. Thanks, guys. Have a great day. Keep smiling. It looks great on you.